I'd like to acknowledge this land that we meet on today is the traditional land of the Kaurna people, and that we respect their spiritual relationship with their country. We also acknowledge the Kaurna people as the custodians of the Adelaide region, and that their cultural and heritage beliefs are still as important to the living Kaurna people today. Good afternoon, my name is Erma Ranieri, Commissioner for Public Sector Employment, and the South Australian President of the Institute of Public Administration South Australia. I'd like to welcome the public sector, IPAA SA partners, professional members, counsellors and supporters to our second instalment of the COVID-19 Mental Wellbeing interview series. I'd like to welcome Luke Broomhall to thank him for being here today. I'd also like to thank my office and IPAA SA who have worked together to deliver today's event. Luke Broomhall is a psychologist and medico-legal expert in the field of forensic psychology. Luke is Director of Acuity Psychology, which provides employee wellbeing and peer support programs, and PsychCheck, which provides psychological assessment and recruitment suitability screening. Over 15 years, practical experience in workers' comp, employee assistance program delivery, critical incident management and forensic psychology, particularly personality disorders, has combined to provide Luke with powerful insight into human behaviour in the workplace. Luke, COVID-19 has put a lens on our wellbeing. Mental health, social isolation, more people working from home, uncertainty, anxiety. Some have relished with that time out, but others haven't. This is a time of mixed emotions. So to kick off, can you tell us a bit about yourself, Luke, and what you're currently doing?
So my work at the moment involves work with both the public sector and private enterprise. We run employee assistance programs and employee wellbeing training to improve the mental health literacy of workforces and individuals. We work in recruitment selection screening, most notably with child protection care, so ensuring that residential care workers are psychologically suitable for task. And I continue my work as a medico-legal expert in the field of forensic psychology, so providing medico-legal expert testimony in criminal cases to do with murder or sex offences, any type of criminal activity. So that keeps me fairly busy.
Oh, extremely busy. Thank you for sharing that with us, Luke. We'll head straight into the questions that people have actually posted for us. What can you see, and I mentioned COVID-19, so what do you see as the current challenges to the mental health of South Australians given this unprecedented time that we're in?
I think you picked up the point in your introduction, which is about just the variability of reactions that people are having. And I think it's difficult for people to get their heads around exactly how many different circumstances there are for people. It's very easy to become involved in our own subjective world about how we see the world in COVID-19. We have our own reactions, of course, but we have to raise our eyes and look above and look at how other individuals might be coping in this environment. And as you picked up, there's such a wide range of reactions that are occurring at the moment. In some households, there might not be too much difference. Some people might be a bit worried that they can't go out and socialise. And to all intents and purposes, the rest of their working life and their social life hasn't changed all that much. Right through to the other extreme and all points in between. And the other extreme are really terrible cases where people are losing their jobs and losing their livelihood, losing businesses, can't see loved ones, coping with illness, even increased incidents of domestic violence or alcohol or substance abuse. So we've got such a broad range of reactions. And I think one of the major challenges we have is to look above our own situation. Of course, we have to look after ourselves first before we look after other people. But we have to raise our eyes and look as a community, not just in ourselves and in our immediate environment, but also broader to the environment that we react with outside of ourselves and see how they're going and check in with people and see how they're going.
Just to go on that point, when you do look after other people, what sort of effect does that actually have on your mental health? So I do know when I give a bit to someone else, it actually makes me feel much better. Is there anything kind of that a psychologist can give us some insight into in terms of how does that make you feel?
Absolutely. There's a lot of research around that idea of altruism and the ability for us to be able to not just look after ourselves, which is vitally important if we're going to look after other people, but the feeling of well-being that comes from connectedness. And we know through social psychology experiments, through well-being research that's been undertaken, particularly in the last 5 or 10 years, that assisting other people and those social connections that we have are vitally important to not only their sense of community and well-being, but also improving and enhancing our own sense of well-being.
And it's a thing that we can actually do no matter whether there's COVID or not, and we've become excellent at Microsoft Teams. So let's talk a bit about public sector employees more specifically. Sounds like you work with quite a few of them. You mentioned child protection, often frontline people. What are the potential mental health impacts for our staff during this time? And it's there are the frontline workers, but all the other workers that are either at home, working from home. And what does it mean? What does their future look like?
That's a good question. I think it's difficult to answer in one particular way, because when we're talking about the public sector, we're talking about 100,000 or so employees and different departments who undertake different roles. So those individuals and those sectors within the public sector, so those departments, are going to be undertaking different types of roles. Some of those will be more affected by COVID-19 and others will be less affected. So we need to differentiate which of the departments are going to be more affected by virtue of what they do. So SA Health is going to be quite a lot different in terms of how they run compared to perhaps some other departments. But within that, I think, and in my experience of working with the public sector broadly, is that there has been a tendency to be a little bit, this is how we do things around here. And that's an attitude that's prevailed through a department or a sector or a section of a department. This is just how we do things. This is how we've always done things. And so this is how we need to keep doing things. So I think one of the major challenges, and this just does relate to mental health as much as it does to service delivery and business within the public sector, is to be agile, is to be adaptive. Is to be able to say, well, this is the way we've done things for a long period of time, but these challenges we have at the moment necessitate change. So we must think more flexibly about how we engage not only with the work that we undertake, but how that work is undertaken. And you mentioned as well, and I think this is a perfect example, you mentioned Teams, Microsoft Teams or Zoom or any other video conferencing. The need to have work from home has just open up a whole new range of ideas that never would have been considered before, not only in the public sector, even in my work. We're doing things now by video conferencing that I would never have thought of, that we've been forced to look at. And now that we're doing them, we're going, oh, this actually works quite well.
It's actually quite efficient.
It can be very efficient, yeah. But as you said, though, there are not only new ways of reaching efficiencies, but there are new challenges that come from that as well. So working from home can be very isolating. People can crave that social contact. They can lose the boundary between work and home. So healthy habits in working from home are really important. It's something we're talking about with people a lot at the moment. So things like ensuring that you have a dedicated workspace at home where work is undertaken, and we recommend that that's not in the bedroom, but there's one place where you go and you sit and you do work. That you plan breaks. That you keep in touch with supervisors and colleagues, that you ensure that you get out of the house and go for a bit of a walk, that you have a digital detox at the end of the day.
Oh, I like that.
Lots of because we're so stuck to our phones and iPads and computers. It's really important to have that break and get some fresh air and do some exercise, maintain social connections, all those healthy things that we know contribute to wellbeing.
You mentioned agile, and we talk a lot about agile. I do too. Can you give me some ideas about what it means for a human being to be agile?
For a human being within the public sector to be agile and a manager within the public sector, as I said, I think the idea with agility is to be able to challenge yourself to look at your dominant paradigms of thinking, so the ways that you do things, and have the ability to reflect and say to yourself honestly, or a mentor or a colleague, honestly have that insight to be able to say, is the way that we work currently the best way to be working? Is it still working? Could there be better ways that we could be doing things? So agility then becomes the ability to say, well, I don't feel comfortable with this new way of doing things, but I can see the old way is not working. I can see merit in the new way. It still makes me feel uncomfortable. And perhaps that's the biggest part of agility, is embracing change that is scary and uncomfortable and unknown. And I think that is one of the biggest challenges we face, is being honest with ourselves and saying, look, that hasn't worked, or it's not working now. Here's a better way of doing it. okay, let's move and let's do it and let's see if it can work.
As a psychologist, though, you'd know that for those of us that maybe have stuck in habits, may not, work towards agility. So I'm just getting a bit deeper into sort of your personality type and the fact that you're in a particular pattern of behaviour. It's often very hard to change those patterns. What's one thing that you might say to people to kind of challenge a pattern? Is it that you can maybe change something up in a day that you don't usually do, or
Definitely start small. So if you're working towards change as a concept, then you can start small with aspects of life that perhaps aren't quite so challenging. But I think really overall it's about remembering that change is uncomfortable. If it feels uncomfortable, it's probably right. You're probably on the right track. Embrace that. Try and get supports around you to not only embrace that feeling of discomfort, but to manage the emotions that come along with it. We become very discouraged if we get out of our comfort zones and what we're used to doing. That if we're doing something we're used to doing, then it feels comfortable, then it must be the right way to do it. But actually we're looking at something completely different, which is embracing the concept that we're doing things differently. It's going to feel uncomfortable. That's how it should. And personality and behaviour change happens over a period of time. So be patient, get supports around you and keep progressing, because the positive feedback will come.
If you feel uncomfortable, you're probably heading in the direction of actually changing things. So something small, like maybe not looking at your phones first thing in the morning, or going for a walk or whatever, if you don't do that, is a good way of starting that.
Absolutely. And I'm a very strong believer, and I wouldn't undertake my profession or job at all if I didn't think that people were capable of great change.
And people of any age.
Of any age.
Yes, absolutely. So you do a lot of work in the public sector, I know that. What are your thoughts on, I guess, leaders and workplaces and how you pick up on people's mental health, especially when you're not actually physically seeing people, apart from on a Teams meeting? So any tips, I guess, for leaders around how we might check in on the mental health and wellbeing of our staff?
Certainly checking in is really important, but I think this is a perfect opportunity to improve mental health literacy. Mental health literacy is that idea that we understand what mental health is and what it's not. And I still think, even though there's been a lot of press and a lot more information about mental health, and people becoming more comfortable with accepting that mental health is something that occurs and that we all have it, it's still not something that people necessarily embrace about themselves or about people around them. So we're still trying to get that message through, and that's why we call it mental health literacy, about the difference between a depression or anxiety or trauma that is long-term, stable and has been around for a long period of time, versus the kind of transient reactions that people will have with anxiety or depression or stress that can occur because of things like COVID-19. So it's not unusual for people to have increased levels of stress or increased levels of depression or anxiety in a situation like we're going through at the moment. So I think that's the first thing for managers and leaders to understand and develop is their mental health literacy. Their understanding of what mental health is and what it's not, that it's normal, and that there are things that they can do. And a lot of managers and leaders will think, well, what can I do? Because I'm not a psychologist, I'm not a counsellor, but you're not in that role. A manager and leader is not expected to be in the role. From my perspective in working with organisations, I've quite often seen that it's managers and leaders who are the first people who identify when there are issues going on for an individual. And the bravery, and it is bravery, to sit down with somebody and have a conversation, not about their mental health, but about the behaviours that they're seeing. And this is one of the key factors that we ask and encourage managers and leaders to look at is, what are you seeing that's different in your staff? Are they more irritable? Are they more withdrawn, socially perhaps? Are they not meeting deadlines that they could meet? Are they talking about a sense of hopelessness, that they can't do their role or that they can't cope? Are they not undertaking work that they usually would undertake? Managers and leaders know their people and they see the changes that occur. So firstly, being able to identify that those are changes, that they might be related to mental health, they may not be, but they're certainly changes for the individual. And the manager and leader having the bravery then to open up a conversation. And the conversation broadly opens up for a manager and leader, but pretty simply along the lines of, Erma, I've noticed lately that you seem a bit more withdrawn and quiet and these things haven't come in and I'm a bit concerned about you and I just want to know if you're okay and if there's anything that I can do.
That's good. I was going to actually ask, could we give people a sentence that they can start with? What if they then come back and actually get hit with something quite significant, like someone is saying, well, maybe bursts out crying, or is feeling a level of anxiety that is then a little bit out of the realm of a leader to know what to do. What advice would you give if it looks like it's more intense than a just how are you going?
Yep, that's a good question, because I think a lot of people are very worried that if they open the question up that the people are going to respond. Well, there are a range of responses that managers and leaders are worried about. Anger is one. Tears are probably the bigger
There's
one.
lots of those
people
around
very
at the
worried about people. What do I do if people burst into tears? Empathise. Give them a tissue. I'll talk about that in a minute. Or there's a range of responses that people might have. Or the other one is, there's nothing wrong with me. I'm completely fine. When clearly there's not. The role of the manager and leader in that encounter with that person is to have a human response. But it's also then to make sure that they stick to what they can and can't control, and then provide resources for that individual to access if there are more serious or personal aspects that they need to consider. So for the manager and leader, the first thing that you deal with is empathy for the emotion that is occurring. So if someone bursts into tears, or if they're angry, or they say, there's nothing wrong with me, the first thing to do is empathise with that emotion. So acknowledge that emotion exists. I understand, I can see you're upset, I understand it's an upsetting time, and that's completely fine. I'm here to listen and talk to you and help in whatever ways I can control. Now, for the manager and leader, that's about understanding what they can control within the remit of their role, versus what then could be referred to an EAP provider, or a general practitioner, or a psychologist, or other resources that they might have to assist that individual.
Something I'm hearing quite often is that leaders themselves are feeling quite anxious, isolated, and unsure about their own futures. Maybe a partner's lost their job, or things are tough for them. I'm hearing that some leaders are actually responding by actually saying, I feel the same. I don't know that that's very helpful for the other individual. So for those leaders, I guess, that are feeling overwhelmed, is it okay to be saying to employees, I guess in a way you're empathising because you feel like you're experiencing it, but it doesn't help. It makes the situation probably a bit more helpless, because you go, well, I'm feeling like this, my leader's feeling like this, it must be bad. So anything that you'd like to kind of comment on in relation to that?
I would, as a manager and leader, I would tend to stick to, I understand how you're feeling. It really depends on the relationship. I would tend to shy away from, I've been feeling the same way. And I would
Even though they are.
Even though they are. Yeah. Well, look, it is good for empathy in some, it really depends on the nature of the relationship between the manager and the individual. It can be useful to say something along the lines of, I understand how you're feeling. It could be useful to say something along the lines of, I've been feeling in a very similar way. But if you're a manager or leader who's going, that's as far as I would go. You wouldn't go then further into, and I've been experiencing this, and then start talking more and more about your own experiences. It just completely puts the other person off. So the advice then would be, I understand, the empathising is, I understand how you might be feeling in that situation, but tell me more about your experiences. Tell me about what you're going through at the moment. And this is already going into a place for the individual that they are, that their emotion has been acknowledged, which is very empowering, and the person wants to know more. They're interested in their experience. And that really helps, because they then have a chance to vocalise how they're feeling, and perhaps in that process they might realise that things aren't quite so bad. Or if they are, then they're directed more accurately to the resources that can help them.
That's great. Great tips. Thank you. So right now we're actually looking at employees actually returning back to the office-based workplaces. And we're hoping that we can have a new normal, so we can actually have a mix. Let's not try and do what we did before. Let's see what we can actually do that's sort of going to the future. But there are people coming back to office-based work. What can workplaces do to make this easier and help employees reconnect socially when we have to distance? Not sure how much, but it is different. It's different. We have sanitisers there. It's actually different. So what can we do to kind of make that as smooth as possible?
It's a good question. It's not just, I think, the transition coming back to work. It's managing the working from home along with the transition coming. It's both of those things that are occurring in tandem, because a lot of workplaces I'm seeing in public sector and private are managing the combination of being back in the office and still, some are working from home, some are part-time working. So we're managing both of those situations still. So On the working from home aspect, mental health and wellbeing is really around ensuring those connections, meetings, making sure that people are on track with what they're doing, but not being overbearing or micromanaging. And that's been a challenge for some managers as well, because they're not seeing their people all the time and they're not having a chance to see every minute thing that they're doing. And some people need autonomy and value autonomy in that role. So those aspects that I talked before about working from home, like creating a space where you work, taking regular breaks, keeping in contact with people, they will become very important. Coming back to the workplace then is getting our heads around the new mix, as you said, the new normal. Which parts of our work are we going to undertake face-to-face and in the office, and which parts are going to work from home? And there needs to be a patience with getting to grips with how that transition is going to look. The social aspects, I think, as you said, it's getting used to the new normal and not getting complacent. And I think that's a challenge that we all face at the moment, is particularly in South Australia, where our rates are relatively low at the moment, but we're seeing in Victoria now that the rates are rising, and we're all worried about that there might be a second wave. So it's really important that we are patient with ourselves and others and don't get complacent. And that applies to the workplace as well. So sticking to those social distancing guidelines, sanitisation, all those kind of things. As you said, the social aspect of it, I'm seeing both sides. I'm seeing that some people are just embracing being back in the office and seeing their work colleagues again, and that sense of reuniting and the old normal coming back into place is really positive for some people. For other people, they're going back into environments where perhaps they weren't very happy and there was some conflict, there might have been some bullying, and I think for managers and leaders then it's being aware of, or at least watching for those incidents where difficulties could arise for people, intervening early and trying to mediate responses.
One of the tips that I think, that's a really good point about who wants to come back and who doesn't, and a lot of agencies have actually surveyed staff. I think if someone's saying that they don't want to come back at all, I think it's sometimes a telltale sign that there might have been something happening in the workplace. So it's a gift that maybe leaders or managers might have to kind of, or someone above that manager or leader, to see whether there are other things that are actually stopping those employees from actually feeling like they want to come back. Yeah. It's not just about the workplace. Yeah, look, let's talk a bit. There's a few questions here about EAPs. So I just want to broadly ask about, so we've given EAP, we've publicised a lot for employees to access. Often they have to make contact with someone. We don't necessarily. Some agencies have people in the workplace. I see them as a very important tool for employees. And you've done a lot of work in that area. We've got other manager assist programs and sometimes, as I said, on-site EAP. Can you talk a bit more about how critical an EAP is and how easy it is for staff to actually access it? Because I find some people who are stuck just don't make that phone call.
Yes, that's right. We've found that as well. And in running EAPs for probably the last 10 or 15 years, I would sit down with somebody. Quite often this would happen. I would like to have seen them 6 months ago when these things actually started. It would have been great to get a bit of earlier intervention. And perhaps also as well, there might have been strategies that a leader or a manager might have been able to put in place had their mental health literacy been better, to be able to head off any difficulties that the person might have. But your point is well made, that an employee assistance program is a really valuable tool for organisations in managing employee wellbeing and mental health.
So take me through a first appointment then. So I need EAP, I contact your company. How does that work?
And you know what? And that's a really brave step. And I've often said to people that is one of the bravest steps that people can make, because if they've had no experience of counselling or psychology or psychiatry in the past, they might have fears or difficulties. They might be judged. They might not be understood. There are all sorts of fears that people have. So a person getting to a point where they feel that they will make that call is such a brave thing to do, and it's something that should be commended. Yes. And it will be rewarded in the majority of cases. So you would make the phone call. There would be a friendly receptionist there who would take your call, would see where organisation you came from, might ask you a preference in terms of a male or a female psychologist if you want to see somebody.
Especially if it's domestic violence. Yeah,
so and in all the EAP as I've run in the past, we've tried to have a good balance of male and female psychologists to provide that choice for people. You would be scheduled an appointment, usually within a couple of days, or at least within a week or so.
Could you tell if it was really, really important and urgent? Would you make it sooner? Is that part of the process?
I've always trained staff in the past at administration. Administration is such a valuable part of our organisation. Administration is the front line. They're the people who triage, they're the people who we rely upon to build the first relationship. That first point of contact is absolutely crucial. And I've always employed people in those roles who have that emotional intelligence, who have empathy, who are really good with people. That's the first thing that we're looking for, to provide that level of comfort at that first point of contact. When you made an appointment, you would come in and you'd generally be quite nervous. And my role in that first session with the EAP, and don't forget, EAP is only 4 sessions or so. So the model is called short-term solution focus. We're not interested in your mother and your father and the deep psychological hurts from the past. They may be relevant, but we're more interested in what's happening for you at the moment. So my role as a psychologist in that first session is to get to grips with what is going on for you at the moment. And generally I wouldn't ask, so why are you here today? Generally I would just engage in normal conversation. So Erma, tell me a bit about your role and what you do. And then I'll move to, and if the issue doesn't fall out there, then I'll move on to, and tell me about your life and your family. Who do you live with? Who's in your life? Who are these people? And the issue might fall out there. Social relationships, marital relationships, children. Health and wellbeing, workplace, home. By the time we've gone through and I've got a good picture of who you actually are and what's going on, generally the issue would fall out there. If it hasn't, I might just then ask the question and say, so what brings you to want to speak to somebody? The first part for me is really about engagement. It's about building trust. It's about building comfort for the person, that they feel that I am somebody who is non-judgmental, who is going to listen to them and try and understand them, and not jump in too early with solutions or answers, but really listen, engage, understand, and then work with the person with their own coping strategies to enhance and develop further, so that they are empowered themselves when they leave to take control of the issues that are happening in their own lives.
And you can bring in some of the tips that you gave us today. That could be part of the conversation.
Absolutely.
Looking at their pattern. And
very practical tips. So particularly if it's mental health, it's understanding that depression and anxiety is normal. It's a normal part of life. And the reactions that can happen from those, some are less functional than others. So increasing alcohol use or gambling or whatever it might be. And again, no judgment. It's a normal thing that people can do. It's just not very helpful sometimes. So we look to try and replace those strategies with more functional coping strategies.
So can depression and anxiety, as you said, it's situational and it can pass?
Definitely, yes, absolutely. Yeah, this is one of the great misnomers, I think, or misunderstandings around mental health, is that depression is something that you are going to be labelled with and you are going to be saddled with for the rest of your life. In the majority of cases, it can be quite transitory and quite normal to experience depressive symptoms. And people are very surprised because they think, well, I understand what depression is, or at least I thought I did, but I thought I was quite strong. And we still have this perception in society that strong people don't get depression, but we do.
I think we've all accessed our EAP providers, and the thing I have to say is at the time you do access it, it's a sense of relief. So I wouldn't hesitate to say to people that no matter where you are in the hierarchy, everyone needs support at some point in time because life happens.
Definitely.
And at the moment, life is happening in a particular way.
Life is
for
very
all
much
of us.
happening, yes.
Yes. Just the point you made around, you don't want to know about the history of the mother, father, whatever. Some people might present to EAP with some significant issues. What happens if the 3 sessions appear to be something that's more longer term? What's the pathway for someone?
Generally with the employee assistance programs that I've run in the past, there would be that 3 or 4 sessions. It's generally short-term solution focused. That would be the end. Perhaps in some cases where I believe there would be benefit to the workplace of funding 1 or 2 more sessions just to get a little bit more security around the changes that are to be made to the advantage of the workplace and the individual, we might ask for an extension of maybe 1 or 2 sessions. But as you've said, where someone comes in and they're presenting with quite serious mental health issues, and that can certainly happen because EAP can be a safe way to access psychological support. And what I've experienced in the past is that we can identify fairly early where these issues are more long-term entrenched, and then I will want to know about your mother and your father and your upbringing and all those kind of things that have happened. We would use the employee assistance program allocation, and then we'd usually ask the person if they want to, if they're seeing benefit, to access their general practitioner for a mental health care plan, and then they would change over into being a private client, and they would usually continue their therapeutic journey under a mental health care plan separate to the employee assistance program.
Great. It sounds like it's really quite seamless.
Very
so that's
seamless,
great.
yeah, completely seamless.
So my final question, How can we help a colleague or a friend that we're concerned about? So we can, we all want to be a psychologist at some point, but you see someone is struggling. But I guess if you're a leader or a manager, you have sort of some responsibility to do that. But what if you see someone that's struggling? What's the best way of actually approaching them? A work colleague, a friend that maybe isn't saying much, but you can see that something's actually happening and you feel quite helpless. Some tips on how we might do that.
Well, I think the first thing that we need to acknowledge is that we need to fit our own oxygen mask first. We need to make sure that we are okay. We need to make sure that we are centred and balanced, that we're not engaging in destructive behaviours ourselves, that we have our good social connections, that we've not let ourselves lapse into bad habits, and it's very easy to do under times of stress. We know that alcohol use is increasing in COVID-19. Yes. We know that social isolation is a problem. So we need to be honest with ourselves in the first instance and ask ourselves continuously. It's almost like a stock take or a mental health plan for ourselves. Am I coping okay myself? Because it's very difficult to help other people and reach out to other people if we're not coping okay ourselves. So I think that's the first thing that we need to understand is we need to look after ourselves and make sure that we are centred and balanced. And then within that context, having looked after those things, then we acknowledge and we see that someone around us is struggling. We would notice the behaviours that occur. So I would really encourage people not to go straight in on are you depressed or are you anxious? They're probably words that will put most people a bit of shock and perhaps disengage them. Really, we want to be focusing on the things that we can see. So I can see that you're more tearful or you're more withdrawn or you seem more anxious or stressed or you're drinking more. We'll be able to see some sort of telltale signs. And that would be the first part of the conversation that would open with. But it comes from a very genuine caring place, which is, Erma, I've noticed over the last couple of weeks that you seem more withdrawn, more tearful, and I've heard a few comments that you've said as well, and I'm just concerned about you. This is not about work. This is about my genuine concern as a human being for you as a human being. And I'm just wondering if there's something that I can talk to you about or you want to talk to me about, or can I help you to access some assistance around those things. But it's really just the first part is non-judgmental engagement in conversation and providing the opportunity for a person to be able to speak openly and to someone they trust.
And even just going out for a coffee or just without actually delving too much in, is it just, as you said, as we started, around sort of socially connecting with people is enough to kind of make them feel like they're valued as a human being. Luke, any final comments that you want to make? I really appreciate all the advice you've given us. Anything that you want to finish off on?
As I've said, I think that the major challenge for us at the moment is to understand just the breadth of experience that is going on for people at the moment. As I said, some people are not experiencing too much change. Other people are experiencing major change. The people losing jobs or losing businesses and the reactions to health or changes in role and job. So as leaders, managers, as any individual, we just need to be very mindful of the differences in experience and empathetic to other people in what they might be going through, and not getting stuck in our own subjective judgment about what it is that somebody else might be going through. And then the other thing I think, which is majorly important for everybody at the moment, is to be patient and tolerant with each other and improve our mental health literacy. So we understand that mental health reactions are normal. They're a normal part of human existence. They're not to be judged, and there is assistance out there through your employee assistance program, managers and leaders, and other resources in the community through counselling and psychology that can be accessed, that can really provide some assistance.
And your own GP, I suppose.
A GP would be a great first point of contact as well.
Luke Broomhall, thank you very much for being with us today.
Thank you, Erma.